taking blood pressure, there are two pieces of equipment that you use. One is a sphygmomanometer, and with a sphygmomanometer, this is the bladder, which is what is inflated. This is the gauge that you use to tell the blood pressure. This is the bulb, which you use to inflate the bladder, and this is the valve, which is what you use to decrease the pressure. You also use a stethoscope, and with a stethoscope you have to make sure that the earpieces are pointed forward towards your nose and fit in your ear canals. And this is also the diaphragm or the bell, which is placed over your brachial artery so you can hear the blood pressure. When taking blood pressure, you have to make sure that the blood pressure cuff is fitted properly, and this is a size chart that shows you from infant to child to adult and to the thigh what the sizes are recommended. You got to watch out for overcuffing, which is where the cuff is too big on the individual and it can cause an inaccurate reading. And undercuffing is where the cuff is too small and it is also going to give you an inaccurate reading. The normal numbers for blood pressure is 120 over 80 of milligrams of mercury. And then pre-hypertensive blood pressure is from 120 to 139 over 80 through 89. And stage 1 is 140 through 159 and 90 through 99. And stage 2 is 160 or above over 100 or above.
Okay, when taking blood pressure, you should have the person sit comfortably for 5 minutes before you start, legs uncrossed, and once you take the blood pressure, the arms should be supported. Knowing your blood pressure is important because it is known as the silent killer. Okay. Systolic blood pressure is how much pressure your blood is exerting on the artery walls while the heart is actually pumping, and then diastolic blood pressure is how much pressure is on the artery walls between heartbeats while the heart is resting. So there is something known as white coat hypertension, and that is where your blood pressure is actually high at the doctor's office and low or normal when it's at home. And then masked hypertension is normal at the doctor's office but high at home.
So when you're taking blood pressure, make sure the cuff is put over the brachial artery, and you make sure the diaphragm is underneath. You're gonna inflate it 20 to 30 millimeters of mercury over the anticipated blood pressure. And then when you're going to check it, you're gonna slowly release the valve 2 to 3 millimeters a second. And to find systolic blood pressure, you're gonna listen for the first turbulent blood flow through the artery. And to find the diastolic number, you're going to listen for the last sound of the turbulent blood flow. And you have Korotkoff noise sounds. They're the turbulent blood flow sound through the arteries. And to find that, you're the first sound. You're gonna listen for the first sound, tapping.
Okay.
I'm going this side.
Yep.
Okay, what is it?
So her blood pressure is 125 over 87.